Hello, this is Steve Bowen from the Iowa Occupational Therapy Association. Today we're talking with Ashley Adams of OTinMe, and the reason I wanted to talk to her today is because of her unique practice in community mental health. So maybe Ashley, if you want to just go ahead and talk a little bit about what you're doing and give that as a start for the introduction.
Yes, so right now I'm providing community-based mental health services as an occupational therapist. So I can see individuals in their homes, in the clinic, and out in the community, so the grocery store, things like that.
Oh, perfect. Thank you. Maybe you can talk a little bit about why you got into mental health practice, or maybe some of that background.
Yeah, so I graduated from Iowa State with my bachelor's in psychology, and mental illness psychology has always been an interest area of mine. Everyone has a story. And so after I graduated from Iowa State, I wasn't quite sure what to do with my bachelor's degree in psychology. So took a little tour around the healthcare field, observed an occupational therapist in a skilled nursing facility, and absolutely loved it.
That's perfect. And so what makes the unique connection between occupational therapy and mental health practice?
So, can you repeat that question one more time?
No problem. So what's the unique connection between occupational therapy and mental health? I mean, why is that a good fit?
So occupational therapists look at other areas of the person that other professionals do not. So we address cognition, we address sensory, coping strategies, relaxation strategies, all in order for someone to be able to complete their ADLs and IEDLs safely. We're awesome in that we do that and take the time to address all those holistic and environmental needs.
And for some of you who may not know, occupational therapy actually started in mental health a long time ago. Do you know any of that history or at all?
So yes, in 1917 during World War I, occupational therapists started treating the soldiers returning from war to help them cope with the war. So that's kind of how occupational therapy and mental health got its start.
And it's really interesting because occupational therapy truly is, at its core, has mental health. Because we do look at the whole person, including what's motivating, what's maybe discouraging, and trying to address those issues. Do you know how many occupational therapists, are there a lot of occupational therapists in mental health right now?
I would say there's a handful. There's a few part-time individuals who work in inpatient settings, acute settings, and we have, I think there's one in Iowa City that works on an assertive community treatment team. I'm not familiar with any others doing community-based services at this time.
Are there ways that occupational therapists can try and expand their current practice and to include more mental health issues?
Absolutely. I think even just simply asking someone how they're feeling regarding anxiety and depression, a lot of the people we see have experienced a traumatic experience, whether that's a medical emergency from having a heart attack or stroke, all the way back to their childhood abuse or anything like that. So even just allowing them the opportunity to speak about it, we can learn a lot, and then do our assessments based on that information and move forward in that way.
Great, thank you. Do you think there's any way that we could maybe push ourselves to actually be officially in mental health? Maybe is there a way to encourage practitioners to go specifically into community mental health or any of these other mental health settings?
Absolutely. So in Illinois, the state next to us, they're actually considered, an occupational therapist is considered a qualified mental health professional, and so they can bill under that title. And so that is a great vantage point for an occupational therapist to kind of show how much we can be involved in mental health. And also just presenting how occupational therapy is effective and cost effective to companies who provide mental health services.
Perfect. I appreciate in my practice trying to address those mental health issues, and I think you've hit on some of those reasons why we as occupational therapists need to think back to our roots in mental health. Think about occupations as part of that mental health process and the overall function of the person. If you're not addressing some sort of mental health, then we're not in my mind, being holistic practitioners. And I know in legislature and for you in Iowa, occupational therapists, we are continually pushing to have occupational therapists more recognized for mental health practice. And so that's something we're doing as an association, working with the lobbyists and the legislators to push that agenda. Occupational therapists as similar to what Illinois is doing. I think Virginia has that in theirs. And California, I believe. There's a few states that are doing that. So maybe, you know, from now until we get to that next legislative session, we can all kind of work together and figure out how to frame that to get that pushed in the legislature. Is there any other final comments you have or thoughts that you want to discuss? Or
I think just occupational therapists need to get their voice out there and advocate for our profession. We are an effective practitioner, we are cost effective, and we just need to get our skills out there and show them that we got it.
No, I think that's great. Yeah, joining the association, getting some of your colleagues to join is definitely the grassroots of that. And then hopefully as we discuss more mental health issues in the state, we can encourage more practitioners to get out there in community mental health. That's one of the areas I think is probably lacking the most. And that's something, not occupational therapy fault, it's kind of like a systemic with the way the legislation is written, and not reimbursing and those types of things. So those are issues we're working through, but I think if we get together, strengthen the association, work together with practitioners, I think we can kind of push mental health again in occupational therapy. So thank you very much for coming.
Yes.
Appreciate you, and we hope, thank you guys for joining us, and we'll hope to see you again on our next video.
Thank you.